So I'm with Susan Connolly. Now, Susan, you're a cardiologist and you've been involved in risk assessment and discussion with patients for many years. And many of us have used the 10-year risk scoring system, but they also now talk about a lifetime risk. How's that different and what difference does it make in your practice?
So 10-year risk is great if your 10-year risk is high and you want to use drug therapy. But the difficulty is 10-year risk, if you're younger or female, your 10-year risk might be quite low, but actually your lifetime risk might be quite high. And we know having optimal risk factors early in life gives you very low lifetime risk, but that applies to only 1 in 10 of us, whereas the majority of us have 1 or 2 risk factors, which increases our lifetime risk. But 10-year risk won't capture that.
And you very amusingly told us that you can actually tell a patient what their actual heart age is. So let's say they're 50 and you say, oh my gosh, your heart age is 65. Have you found that a useful tool to help get people engaged in that conversation?
Absolutely. So we used to show them the risk scores that were in the back of the BNF, and you used to get a lot of blank looks. Heart age immediately causes the head of the patient to swivel, and you can see registration on their faces. It's so intuitive. I think patients understand it better. But there is some evidence that it can be somewhat harmful and it can cause alarm to patients, particularly if there's a big gap between their chronological age and their heart age.
So you have to do it gently with them.
Yeah, and emphasise the positives that actually this is modifiable, and that's really where it's useful in the clinical consultation.
And if people, just finally, if people want to find out more about this or actually calculate heart age, where should they go for the resource?
So you can actually calculate your own heart age online. You go to NHS Choices, Google heart age NHS Choices, and it allows you to calculate your own heart age. Preferably have your cholesterol, but you can do it without it.
Susan, thank you very much indeed.
Thanks, Martin.